Are you paying more for Medicare and insurance than you ever have before? Well, guess what? There's some good news on the way. Stay tuned. Greetings and salutations, everyone in YouTube land. This is Rick MacDermid with Senior Solutions Group in beautiful Yakima, Washington, where we're still in the midst of summer. So starting on Saturday, the 1st of October, all the Medicare plans will be updated on Medicare.gov. So you can have lots of fun looking at all the changes in Medicare. If your prescription drug plan sent you a nasty letter saying that the plan is going to be doubling or tripling in price, well, guess what? You can do some research, or you can reach out to your agent. If you don't have an agent, feel free to reach out to us at Senior Solutions Group, and we'll be happy to help in any way we can. So just this week, CMS, the Center for Medicare and Medicaid Services, dropped the Medicare premiums for 2023, and they are as follows. This is right off their press release. So September 27th of 2022, the Center for Medicare and Medicaid Services released the 2023 premiums, deductibles, and coinsurance amount for Medicare Part A and Part B programs. So the Part B covers your doctor visits, your outpatient care, if you go to an outpatient hospital service, if you need a same-day surgery, certain home care services, durable medical equipment. Part A would cover if you go to the hospital and you're actually admitted. So most of the time you'll use Part B, not Part A. So each year the Medicare Part B premiums usually goes up. Last year it went up almost 15%, in part due to one drug called Autohelm, which was somehow approved by the FDA, should have never been approved, at a price tag of $56,200, give or take, per person per year for this treatment. Medicare got spooked and raised almost everyone's premium almost 15%, from $148 up to $170.10 in 2022. So that amount went from $148 to $170 in 1 year alone. So this next year, it will actually go down to $164.90, in part because Medicare actually never covered that drug after all. They decided to only cover it for a special test group case study people, which is a very minute percentage of the population of people that have Alzheimer's. So next year, you're going to get a big pay raise if you're on Social Security, and the cost to be enrolled in Medicare will drop about, well, $5.20. The annual deductible for all people on Medicare Part B will also drop to $226, a decrease of $7 from the annual deductible of $233, which went up $30 in 2022 from 2021. So there's a talk about Autohelm. You can read the article. We're gonna link this article as well. And also it talks about people who are 36 months post kidney transplant who no longer are eligible for full Medicare coverage. They can elect to continue to pay to be on Medicare. They're going to talk about that. That's a very small percentage of the population, very small sliver. The Medicare open enrollment period for 2023 will begin October 15th and ends on Pearl Harbor Day, December 7th of 2022. During this time, this is the time when you can change your drug plan or your Medicare Advantage plan, or sign up for prescription drug coverage or for Medicare Advantage. You can change your Medicare supplement plan year-round. A lot of people don't realize that. As a matter of fact, most people think that you can only change your supplement during this time frame. You can actually change your Medicare supplement plan year-round, and in a few states there are no health questions. Washington State, where we live, being one of them. So if you're overpaying for your supplement, reach out to your agent. If you don't have an agent, reach out to us at Senior Solutions Group. We want to help you as best we can. So there's also going to be some changes this coming year for people that are paying extra for Part B due to your income. You can read about that as well in this article. So people who make more than $97,000, if your adjusted gross income in 2021, they always go back 2 years, or if you're married, if it's less than $194, you'll just pay the standard rate of $164.90. Those who have a greater income will pay up to $230.80 all the way up to $560 per person per month. So if you're married, you can pay that times 2. So you can follow this link that we're going to link to the article, as well as if you really want to get into the weeds on this, you can read the actual report from the government, the actual government, not just the press release. That's going to be linked in the article that we're linking. So good information. You want to be aware, if you're on Medicare, to not fall prey to these commercials that are the real reason why we're having to record all of our phone calls starting October 1st. There's been a lot of complaints through the last couple years. A lot of these companies that are hiring these call centers are seeing their stock prices plunge because of all the complaints, all the rapid disenrollments. So people would call one of these celebrity ads and get sweet-talked into signing up for a plan. What usually happens, if you call this 800 number, they find out you're on one plan, they're going to put you on another plan. And that very same plan that they put you on for another person, they're going to get you off of that plan. So it's like musical chairs. By hook or by crook, they're going to try to change your plan. That's not how we roll at Senior Solutions Group. We're going to treat you like we would our mom and dad, because you're important to us. You're going to tell your friends, hey, you know, I talked to this agent, and you know what? They treated us with respect, with dignity. We felt like we actually mattered. They weren't just trying to make a sale. And that's very important, because relationships matter in life. If we treat our people well, you're going to tell your friends, and they're going to tell their friends. As a matter of fact, I had some people that talked to us today. They were referred by friends of friends of friends. And that's kind of how it works. You know, they show up to say, hey, I knew your dad. He cut hair back in the day. Yep, that's right. How did you remember that? Well, I took care of them in 1998. Does he still have his Model A? Well, no, we sold it, and he's in assisted living now. That's how we roll. We love our clients. If you don't have an agent, reach out to us. We're here for you at Senior Solutions Group, and we love what we do. Feel free to comment below if you have any comments on this, and subscribe if you haven't done so already. Take care.